Are we live?
Awesome. Doctors in demand today. We are so pumped to talk about the regular things you can get tested in your blood work. So usually people get covered, like one screening lab a year, and sometimes you can ask for these things to be added. They're in our screening labs, right, Hillary? These are pretty basic lab tests, would you say?
These are basic lab tests. The zinc is not a basic lab test. No, the zinc is something that it's worth asking for. So we're talking about labs that you're looking at your total that help give you a sense for how you're absorbing your nutrients, how you're using your minerals and your nutrients, and some things that are easy to correct that can make a big difference for your overall health and longevity. And that is B12 and a ferritin or some extra iron studies and zinc. The zinc can be tested in two different ways. So we'll talk about that when we get there. But let's talk about B12 because B12 is one that is, these are things that are often not on screening tests. But if you ask your doctor to do, they're really not a big deal and they're easy to justify for insurance companies. So they should be easy add-ons if you want to ask your doctor.
And B12, the first one, you do see that often in screens, but it should be, I would argue, it's completely bad medicine not to screen a B12, especially in someone who's older, because as we age, we don't make enough of this thing in our stomach, intrinsic factor, to absorb B12. So it without a doubt should be in regular screening for anyone who's over 40, because we know that part of aging, we make less intrinsic factor, and we know that that can lead to low B12, and there's serious side effects of low B12, and we see it all the time. How many patients come in with low B12?
I mean, everybody needs to get it tested because teenagers are notorious for having low B12, and it has such an impact on mental health. So B12 is
for teenagers, it's different than the intrinsic. Why teenagers? It's their diet. Yeah,
it's their it's stress. So let's just B12 is absorbed in the stomach. Kara was just saying you need this thing called intrinsic factor to help absorb it. There's a couple things that contribute to low B12 absorption, and one of them is like low stomach acid. So if your stomach acid's low, which can happen if you're under stress. So teenagers, it dumps because they are under so much continual stress. They live stressful lifestyles. I don't know if anyone's hung out with teenagers in your homes, but they don't sleep a lot. They have a lot of stress. They stay up late. They don't eat great food generally. And then they might be doing things like drinking or smoking or doing some things that use up some of their major vitamins. So most teenagers that I test that are not supplemented. So I'm just here to say it's not just an aging issue, that everybody should get their B12 tested, because a low B12 in a teenager can cause a lot of mental health issues. B12 is connected to our energy. It's connected to anxiety, depression, fatigue. It impacts the way that we have cellular energy and the way that we correct our DNA copying and repair. It's really important for as we're aging and correctly repairing, copying our DNA and copying cells, that we have enough of it. And this is something that dumps a lot in our society. It's really interesting. I mean, I'll check a B12, and this is a thing that's got a massive range. So the range for a B12 is somewhere between, depending on the lab, between 250 and 1,100 or 1,000. So some people will look normal, but they're in the 200s. And I just think that my patients, I want them to be in the 700s, 800s, 900s, upwards levels of B12. So
let me hop in on the levels. I had done a deep dive on this, because I was like, this can't be right. And any other country you're in, you're in Japan, any other country you're in, you cannot have a 250 and be not deficient. You have to be under 400. So it is a problem with our labs, without a doubt, that the range people's doctors will be like, sure, I'll order the B12, but they don't know that if they're below 400, they're truly deficient and need supplementation. But it's a real issue for a lot of people. You can't make your happy chemicals without B12. You can't replicate your cells without B12. You can't repair anything without B12. So it's a really big deal. And there are serious, problems as far as nervous system problems. People can have aches, pains, nerve pain. How much neck pain I see in Chinese medicine that turns out to be a B12 deficiency. It's absolutely incredible what B12 can do for people. And you don't, honestly, if you're a vegetarian, you're not getting any B12 in your diet. And so they're very likely to be low. And these teenagers eat all carbohydrates.
I know.
They're on a strict carbohydrate diet. Most of these teens, they're not eating eggs enough. They're not eating their chicken. They're not eating the stuff that has high B12. So how are they supposed to get it?
And the B12, there is an epidemic of depression and anxiety, and having a normal or higher, a robust B12 level is so important for anybody to correct before they start any kind of longer term medication treatment. Like I'm not saying that medications aren't important at some point for some people. That's not what I'm talking about. I'm just talking about, like, if you have a bucket and there's holes in the bucket and water is falling out of the bucket because of the holes, you have to patch the holes before you move forward.
And who would that look like, though? That would look like anyone who's like, I'm tired all the time. Could be
brain fog, fatigue, muscle pain, nerve pain. I mean, it's a lot of people. Headaches, depression, anxiety, insomnia. It's a lot.
It's a lot, but you're going to laugh because I tell you this all the time whenever B12 comes up, because I tell this to our patients, right? They do studies on, or do we even call them nursing homes anymore? What do we call these things? Where older people will go live in a community and be taken care of. Okay. At the time of the research studies, they were called nursing homes, and correct me if I'm wrong. I really don't know, but I'm not sure if that's okay or not to say. But when the research was done, that's what we called it. And they would go in and say, oh, all these people are like tired and depressed and all of this stuff. And then they just go in and give them B12. Just give them B12. These are people over 65. And so many of the people got so much better and had so much energy. And now they weren't depressed anymore. And they just a simple little B vitamin. And it's inexpensive and easy to get.
It's inexpensive. It's easy. It's non-toxic. It's water soluble. So, like, you really can't screw it up. I like to get the level tested, because in my patients, I can't, even last week, every single person I'm mostly testing that's not supplementing is in the 2s, the 3s, the 400s. I don't have anybody that's just like a robust number that isn't testing. So I think we're just under so much stress, we're not absorbing well. And sources of B12, like beef is a good source. The vegans often know about it, and vegans often supplement B12. Like, the vegans do a pretty good job.
They need it. Yeah.
But the people who don't do a great job are like what you just described, people who aren't vegan or so they're not like up hip to it, but they don't eat a ton of meat, and then they kind of prefer carbohydrates. So the things that's really high in B12, we don't just have a lot of in our diet. Like, it's all the little baby fish, like mackerel and the little anchovies and clams and liver. Like, these are things that in our society we don't eat a ton of. Beef definitely has it. Eggs have it, but eggs so much less than like liver or clams. Like, a serving size of clams, 84 micrograms of B12. A serving size or one egg, 0.6.
Wait, what's a serving size of clams?
0.3, 3 ounces. I don't even know what that means, because we're not like just natural born fish eaters, but this comes back again. Back to like the Mediterranean diet and diets where there's just a lot of natural occurring seafood.
Need variety, right?
In the diet. And a salmon definitely has it. But like, I'm just here to say, like liver, which is not a big staple in the United States diet, especially for teenagers or mothers or perimenopausal women. Or not a lot of people are running around eating liver. Like I'm telling you, when I lived in Spain, my Italian friends, they ate liver and tripe once a week, like stomach and
like heart muscle on the grill and stuff. You know, it's like we just don't eat this stuff.
We just don't, we're like little American, like, man, we just eat the nice cuts of meat. And then we, but eggs, yes, it has it, but it's not a hugely robust source. Chicken, not a hugely robust source.
But I think that's kind of where people mostly will get it. And then also people say, oh, I'm taking a multivitamin, but it's quite low in many multivitamins and in maybe a form that's not ideal either. So even if you're on a multivitamin, it's worth asking your doctor to check B12. It's such an easy test to order. It just goes in your regular blood work. That's a good one. Should we
transition to order? Like this is like a no-brainer.
Yeah. And the next one's a no-brainer too.
Okay. The last thing I want to say about B12, and we'll do a whole show on it. We're going to do a whole show on what's called methylation and B12, B vitamin methylation. But like, many people are genetically predisposed to not using B12 well. So like in a lot of the things that are fortified, like fortified cereals or those are using pretty bad sources or kinds of these B vitamins. So you really want to work with your doctor on it. And there's more advanced things that we'll talk about. We should do a whole day on like B12, methylmalonic acid, homocysteine, blah, 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 blah. But for now, just make sure that you know what your B12 level is and that it is, if you are suffering from any of the things that we talked about, that you are taking B12. Mm-hmm. And many people do it in a shot. It's not necessary in a shot. It's definitely absorbed really easily. It can be done in a lozenge. If people can't swallow pills, mm-hmm. you can use there's a lot of lozenges or sublingual forms of B12.
There was a period of time where I used to give myself these injections because I was a vegetarian a long time. And I will say that I used to get up at like so early in the morning when I was consistent on those injections. Like I just knew there's something to this, that I have so much more energy. I was like being out of bed, it's like by 5 a.m. I was like, I don't even need any more sleep. So the high B vitamins is kind of a key to energy for a bunch of people. I think it's probably a lot of the population need high Bs. Because we use them up in stress.
We're stressed. We run around. We're busy. We do not have chill lifestyles. Anyway, we need them. So if you're tired, can we please get your B12 checked? Okay. Yeah. And then if you're tired, the next thing, or depressed, or have brain fog, have any kind of shortness of breath if you're walking up a hill, if you feel if you look pale, if your conjunctiva.
Oh, I think yours looks pale. I can see it from here.
Really? It's just my gray hair reflecting.
No, I don't know. I'm just saying.
It shouldn't be, for God's sake.
It should be bright red, right?
I take a lot of this. So what we also want to check is your iron. Many people, and that is the iron storage. We want you to check your iron storage, which is done by a ferritin. So many people have it on their fasting blood work. Many people don't.
Most do not.
I'm going to tell you about a patient that I had last week that's gone as having major anxiety and depression, has been seen by 2 psychiatrists. And I am not busting any doctor. I don't ever want to throw doctors under the bus. Everybody's doing the very best they can. It's not my, but it's just goes to show you what we can learn when we do more advanced lab testing. So her CBC, her complete blood count, looked normal. She did not look like she had iron deficiency anemia, but she suffered a great blood loss from an injury in October. And so depression, brain fog, like on antidepressants. Her ferritin, which is her total iron storage, was a 3. Like that is so low. The ferritin is, again, something that has this enormous range. Mm-hmm. What's considered normal on most labs, I think, is 30 to like 150.
It's crazy. Again.
And if you're if you have a ferritin of 30, I promise you don't feel awesome. You feel way better than if you have a 3. So this lady wasn't picked up for iron deficiency anemia because her hemoglobin hadn't quite dumped. And when you looked back at her old labs, she was used to having an extraordinarily high hemoglobin level. So it had dumped for her, but not flagged as low. So if you're just looking at it quickly, you're like, oh, she's not anemic. But a storage, anemia is a really complex thing that we're not going to get into. All the ins and outs, it's super complex, but ferritin tells you about the total iron storage. And for women who lose blood regularly, it is very hard to maintain a robust ferritin. And a robust ferritin is crucial for fertility, for miscarriage prevention, for energy, for happiness, for mood, for good sleep.
I always say anyone around 20, which is like in the 20s or around 20, you're just tired. You have to be fatigued. There's no way you're not fatigued. There's no way. But your body, Hillary, this makes sense to us, right? Your body will do everything it can to not make you anemic and to make sure your cells are all getting oxygen and it make red blood cells. So it comes from the bone marrow, and like your body will pump it out, pump it out, pump it out, because you need oxygen to cells. It's going to cause stress on every cell. We need oxygen. You know, it's going to cause more oxidative stress if we don't have robust red blood cells running around our blood. And so it makes sense that it will like keep up the CBC, you know, it'll keep looking like you're not anemic until it doesn't. So low ferritin is a good find because it could take 2-3 years for that person to become anemic, but you had all this time to fix the problem. It's so easy to fix that problem. Usually.
You guys, we can't tell you. I mean, the amount of women that come in and their ferritin is low, I can't tell you. And it's like when you
how do you function? You can't get oxygen to like your brain, your muscles, your anything. Like you have to be just dry. It's like mental. It shows you how strong people are. Like they mentally can just like do what they have to do because they're like turning off the exhaustion. They're just turning it off.
But the thing people have been telling me is like, oh my God, I didn't know how bad I felt. Yes. I mean, we hear this all the time, right? I didn't know how bad I felt until I felt better. And it you know, it's just like the second you get glasses, if you've been like just dealing with your bad vision and then you put glasses on and you're like, oh my God. I mean, I had no idea how freaking blind I was until I got the glasses. And
I remember the tree branches. I could see all the little tree branches, like, you know, driving the car or walking by. And I couldn't see that before I figured out I had bad eyes in like 5th or 6th grade. That's true. I was like, wow.
Mine was college. And I like kept having to get closer and closer to the like sit in the front. I was like, what the hell's happening? And then like I finally went and got glasses and I was like, oh my God, I like shouldn't be driving like this.
Oh, you should not be driving. That's hilarious.
But this is how it is with your iron storage. Like iron storage is so important. And yes, there are people who take on too much iron. And yes, having too much iron can be toxic. You want to have the just right amount, which is exactly why you should have your ferritin tested at least every year. And if you've gone through a big bleed, like if you've been in an accident or you've had something where you've had a major blood loss, then it's really important that you check your ferritin and that you're on it. And for women who are heavy bleeders, for women who have endometriosis, or for women who have fibroids, or for perimenopausal women who are starting to bleed like every 21 days, every 14 days, your iron is going to be in the dump, your ferritin. So ferritin is a marker of total iron storage. Now it can get a little tricky because it's what's called an acute phase reactant. So sometimes it can be elevated, falsely elevated, if there's some other inflammatory process happening in the body. So you have to be discerning. If you have all the symptoms of anemia and your other counts, your MCV is low or your hemoglobin's low and your ferritin's high, usually that higher ferritin is a sign of inflammation. So obviously these need to be read by somebody with some medical experience, and that's a doctor, but you don't know if you don't get it tested. And
And I just want to say one thing about that though, because so many times someone's having anxiety because your body is telling you something's wrong, something's wrong, something's wrong. Like it's not, I think we think, oh, this is in our head or whatever. Like I just need to control my mind. Sometimes it's your body telling you, hey, I'm not getting enough oxygen to my tissues. Maybe I need some support here. So it's really important to do this basic blood work and rule out all these things you can easily tweak before we think about, okay, what's the next step? It's really basic. And we should be thinking that way as a society, like, oh, you're having some anxiety and that's, why? What could your body be trying to tell you? It's important.
And unfortunately, in the medicine that we are in the system that we are in, where we are divisible by parts, many people will only go see a doctor for their head, a psychiatrist. Now, psychiatrists are trained in medicine and they're super brilliant. And so like most of them should be running labs. It's pretty much the standard of care for a new patient that somebody's running these basic labs, but it gets missed a lot in post-COVID, even more because the system's under such pressure because our mental health really declined so significantly. So even if you're being seen by a psychiatrist and you've been diagnosed with something, if you have a bucket with holes in it and you're spilling water out of the holes, ain't no antidepressant going to make you feel better or take over for the ferritin that's in the tank or the B12 that's in the tank.
Let's just say it. These medications are not phenomenal medications, right?
No.
Like it's not like, oh, I went on this, it totally fixed my life. That's a very rare story to hear. It's like I went on this and then I had to try this and then we tried this other one. That's the story we hear. That's real. That's absolutely real. So doing that, it may be appropriate for people, but you really could serve yourself by doing all of these things that are not so hard to do, because maybe a piece of it, maybe 20% of it is nutritional. Maybe 20% of it is your life circumstance. Maybe another 20 is your sleep. Like this whole thing where we just like go on a medication for depression is very difficult to swallow. It really is, because those meds don't even have phenomenal research. They really don't.
So the moral of the story is check your shit out, check your stuff out, and then fill the bucket, fill the holes in the bucket, please. Like it's amazing what humans do when their bucket has the holes full. It's like literally, it's like watering. I got home from being in, you guys might have known that I was in Boston, seeing as there was a show from a dorm room in a really dark hotel room. And I was on the road. I'm going on
lighting today. Wow.
Yeah. And but it's amazing. I came home and there had been a heat wave in California. I'm clearly missed it because right now it's so dismal outside. But my plants were, you know how it is when the mom leaves home and the plants, I was like, you guys, if you walk by a plant where the leaves are all like touching the sink counter, just like this, like, do you not get the memo that it's thirsty? Like, give the plant water. What's wrong with you people? You wash your hands right next to the plant.
No, I have all the herbs on the table. Like it's like all the herbs are ready to go out in the garden. I come home and like they're all like limp, like hanging down. I'm like, even like everything. And I watered before I left. I came home. I'm like, I just don't understand. They're picking the basil to eat it, but they don't notice that it's like hanging.
But my point is when you fill a bucket, if there's holes in your bucket and you fill the holes, it will literally look like this sad ass plant that just got watered. Like all of a sudden you walk in an hour later and the plant's like, I'm alive. I choose life, you know?
I will say that didn't happen to all of mine.
No, mine. I think this one's dead. I'm like, you guys, dead, gone dead. Like it just, anyway. Okay. So the third test that we want to touch on, and this one can be a little trickier to get people to screen. It's a little more expensive and it's a little more nuanced, but this is called an RBC zinc, a red blood cell zinc. You can test a regular zinc and get some good information, but the RBC zinc is by far the much better way to see if you've got a zinc deficiency. And I find zinc deficiencies in a ton of my patients. Why? Because if you're stressed, because this is another one that's absorbed right where we need a good amount of stomach acid. We can't be stressed. It's so massively used under stressful conditions and under stressful like immune conditions. So your zinc is cornerstone to your health and well-being and how you feel. And for many, many, many of my patients, I find it just dumped in the tank. Do you?
I mean, all the time, but I think that zinc, like we probably started testing it for women's health. So zinc is one of those key ones. It's a mineral and it's a trace mineral. You know, it comes from seeds and some of our vegetables. Bizarrely, zinc is really high in pork and some of the meat foods, which I don't usually think of, but that is true if you look at the list. And the problem is that our soils are horribly depleted in zinc. The way that we have farmed and taken care of our soil in this country has just led to really low mineral counts. And so even if I go get an organic pepper from the farmer's market, I'm not getting the nutrients I need from the soil because they're just not there. So it's a real issue in the whole system. And so looking at these minerals is key. And, you know, for anti-aging, there's a lot of research on zinc for the immune response. And it looks like the body can't repair it. You know, zinc is one of those things we learn about for skin repair and stuff. It's good for our immune systems. And so I think that the real issue for us is, again, as we age, we absorb less, and it will cause, having less zinc will cause oxidative stress, like actual damage to our tissues. And zinc is one of those things you need to repair that. And so zinc is a key mineral that you find low, but zinc can do wonders for certain people as far as their menstrual cycles, regulating ovulation, all these kind of things. So for women, especially, zinc is incredible. And for men, it's incredible as far as immune system and healing. So,
and testosterone.
Yeah.
They need it to make testosterone. So it's really important for hormone balance. It's hair, skin, and nails. Like if your hair's thinning, if you're fatigued, again, brain fog, getting sick frequently. You know, what's really interesting is zinc deficiency is lack of smell and lack of taste. So I was always wondering, like at the beginning of COVID, like, is that because it's like dumping the zinc right away? And that's a zinc deficiency symptom. Obviously, we were using zinc, high doses of zinc to treat COVID quite effectively, or to manage COVID really effectively. And because we were a society of zinc deficient people, we were more susceptible. And honestly, the people who had extraordinarily robust levels of zinc during COVID, they got COVID much, much, much more easily. It's better.
Like all our winter supplements we recommend have, usually those blends have some zinc in it. So zinc is often low in people, and it's just not ever tested. That's the problem. So coding for zinc testing can be really tricky. So in a way, you know, asking for the zinc, many doctors won't even know what a red blood cell zinc is. Honestly, you'll hear, we hear that back, right? So we know that, but ask for a red blood cell zinc and say, you know, whatever it is that you have going on. Like, I got so many colds last year, I'm just wondering if I'm low in zinc and should take it through the winter. Or, you know, my menstrual cycle's off, maybe I should be taking it. If you're a man, you know, you also need to test it. So it's a good one. We don't test that as much.
I have brain issues, or I have memory problems, or I have, you know, like fatigue and depression. All low zinc can contribute to all of those things. It potentiates things like anorexia nervosa or eating disorders where there's anxiety disorders. So
absolutely. That's interesting research, Hill, that you just touched on. Like, some of these eating disorders, you give the people zinc and all of a sudden they're better. I mean, that is incredible to me. So that's like, if you have that at all, that might be a really good place to start, because if you can change the way your brain thinks, that's amazing.
And with patients like teenagers, or I'd say patients who are under a huge stress and go through, like, you know, if you start a divorce process or lose somebody that you love, or you're under major stress and you go through a period of literal anorexia, not anorexia nervosa, but you're just not eating as much.
Oh yeah.
Your zinc will dump, right?
Definitely.
And then it's just one of those things that really contributes to the anxiety, the depression, the brain fog, all the things that happen when a creature's under significant stress. So
yeah, like I go under stress, I'm just not hungry at all. I almost feel nauseated. So I just can't even consider eating, like, under stress. And so the weight just goes, like, by accident, you know?
Yeah. Some of us have a much different stress response.
Yeah, but you've seen me have that through the years where I'll be like, whoa, this is like something's going on. Like you can't, it's like for me, if stress is like out of control, which I do a lot of things to control stress, but sometimes that does happen. Things happen in life. I'm old. Things have happened. And so, yeah, that's a real, well, I'm old enough to have had many things happen.
Old enough to have things.
But I do notice like that if I'm like, it's weird. I skipped lunch. I'm not hungry. Cause you know me, I'm like hungry all the time. I'm like, what is going on? Like, this thing that's going on is like affecting me and I have to like catch on to it. Cause one time after a very stressful period of time, I did do a food, like nutrition test. I had 7 nutrient deficiencies to the point where the doctor who worked with me knows, I eat so well and I really spend a lot of time on this, He was like, how do you have 7 nutrient deficiencies? I'm like, there was a death. I didn't eat for like months. I was so upset, and it really made sense. It was like, and look, it's right here. And all of these things were deficient in there, along with choline and vitamin D and a bunch of other stuff. Because of course, when I'm stressed, I'm not going to go for like eating eggs or any meat at all. I want to like, I don't know, eat something light, right?
So we learned in medicine not to always look for the zebra, and it's obviously anxiety and depression are not zebras. But when you're let's just get what we call it's the low hanging fruit. Let's fix the low hanging fruit. If we have a patient that's having depression, anxiety, brain fog, whatever, insomnia, and you're just fill the holes in the bucket.
Yeah.
Get your test.
Even if it's like you're 20% better, that's phenomenal.
It's amazing.
I mean, why wouldn't we do something so easy if that's it, Okay,
it's one of the most fun things doing this job because you fix somebody's B12, you fix their zinc, and you fix their iron. You get them on B vitamins and usually a great fish oil, and then all of a sudden they're like, I feel so much better. And you're like, wow, look at that's amazing. You're totally healing yourself. It's so awesome. A lot of medicine and longevity comes down to really basics and making sure that you're managing your basics. So more to come on all that. Lots of love. Happy Monday. Bye, everybody.
Bye.